I invite Dr. Geethakrishnan, who is head of Holistic Medicine, Medanta Hospital, New Delhi. He is also trustee of World Ayurveda Foundation. Dr. Geethakrishnan is a researcher, clinician, and an effective administrator. His broad background expertise is in Ayurveda with specific skills, training, and experience in clinical application of Panchakarma, Yoga, and Marma. His core competency is integrative medicine, for which he has acquired unparalleled experience-based expertise from clinical practice and research as the head of Department of Integrative Medicine at Medanta, the Medicity Hospital. He also has knowledge and extensive experience in ethnomedicine-based herbal drug research. He has several completed and ongoing clinical research projects to his credit as a principal investigator in the areas of cancer.
In fact, I should start my lecture of 20 minutes. I'll take 5 minutes extra because I'm going to talk something else during these 5 minutes. To the Ministry of Ayush, Government of India, to the High Commission of India, and of course to APAS for having created this event out of nothingness in the past 2 years. And I was telling one of the persons who came to speak to me, what is the difference that you find between the first international conference in Singapore and the second international conference. Is a great, I think there is a big stride, I think there are a lot of people who had come more than last year. There's a lot of interest, this is more focused, more people coming to understand about Ayurveda and its utility. That is the biggest thing. And I think there is a profound interest shown by the government as well as the Singapore government in including Ayurveda into the community and utility of the citizens of Singapore. That's a great advantage and great stride with the conference, in between the conference which had happened, because a conference does not do anything. It just creates a like a platform. But I can imagine the kind of work APAS has done during this past 1 year or 12 months, within which this kind of a change could be made, and they have also utilized the environment. I who work with several organizations in organizing programs across the globe find a lot of similarities in many different kinds of programs happening across the globe. For example, there are similar programs of people coming together to form Ayurvedic communities in US, in Africa, in Middle East. For example, like in Middle East, in Dubai, I think in November there is going to be one conference on international conference and exhibition on Ayush. Like there's a program going to happen in November. And Dubai, exactly like Singapore, which is a hub of Southeast Asia, Dubai is a hub of Middle East. So there are a lot of similarities which I can find, and similar things are happening. I think with the new Secretary of Ayush being from Ayurveda itself, and the time taken by a new secretary to understand the nuances of traditional medicine might come down quite a lot, and therefore we can expect a lot of deliverables in the next 3 years. And I'm sure that APAS will utilize that opportunity and make great strides in improving the possibilities of Ayurveda in Singapore. With this, and with your permission, I will go into my presentation. This is actually a continuation of my presentation which was last year. It's just an update of my last year's presentation, because last year I had presented to you what I had done till 2014. So this is what I have done till 2016 September, and this is a base document which I had prepared for my chairman of my institute, and this is just a presentation which I have not made any changes in the presentation. So I thought that I will read out of I'll talk about what is there in the slide, but mostly you can see what we have done in the presentation by looking at the presentation itself. So this ours is a big hospital in the country in India, and we are a multi-speciality hospital. So there are the reason why I chose this presentation as such is that when I was speaking to with the leadership of APAS, I came to understand that there could be allopathic doctors in this program, and they would be quite interested in understanding how to utilize, how to include Ayurveda, or how to include Ayurveda into the community and for the patient benefit. So I thought that it had a lot of resemblance with what I was trying to do, and therefore I thought that I will use this presentation. So my program or my research activity related to integrative medicine started in 2010, and we started our inpatient facility, outpatient facility by 2011. And this document is about, about 6 years of data starting from 2011 to 2016. I have seen around 13,000, nearly 14,000 patients during this period. We have done around 10 outcomes research programs. We have around 6 registered clinical trials and drug development programs, etc., etc. Now, if you look at what are the main areas which we have been able to deliver in a clinical setting, which is mostly modern medical, dominated clinical setting, I have been very good in managing low back pain, osteoarthritis, knee joint, chronic pelvic pain syndrome, cancer supportive care, especially insomnia, post-CABG constipation, minimally invasive thoracic surgery within a protocol of yoga, stroke management, post-thoracotomy pain, migraine, dengue, and acne scars, and melasma. These are our top 10. If you ask me which are the top 10 areas, clinical areas which I work on, these are the top 10 clinical areas which I work on, and we have definite benefit in many aspects as far as the patients are concerned and the clinical outcomes are concerned. If you look at, and if you ask me how I classify the kind of patients who come to me or kind of diseases who come to me, it is either they come directly to us, to the Ayurvedic department, and we classify them as an independent group of people who come to us, which includes back pain, osteoarthritis, knee joint, constipation, some cancer patients, like depression, stress, etc., which is there in the green, which is colored green. And then there are need-based referrals. The need-based referrals have been developed because we have been able to provide evidence to the allopathic counterpart saying that you have a problem here with managing your patient in this clinical condition, and I with Ayurveda or yoga can help you. So that's what we have been doing. We have been able to convince the neurosurgeon that we have better management in back pain. We have been able to convince the orthopedic surgeon that we have better management in than knee joint replacement for knee joint pain. We have been able to convince the CABG, like a open heart surgeon, a surgeon who does open heart surgery, that post surgery the stiffness which the patients developed can be very well managed with Ayurveda. So there are several such cases we get, and then we run integrated medical programs, where in which the program itself is integrated. So there is no distinction between Ayurveda and modern medicine. We think that this is one single package which is given to the patient, which is post pre-VATS, like every single patient who goes for a video assisted thoracic surgery gets yoga as part of it. Post CABG or cardiothoracic surgery, constipation, every patient gets Ayurvedic medicine. No allopathic medicine is given. So interestingly, I will come to this, but interestingly, I would like to note that you were asking about drug-to-drug reaction. So we have been doing some studies. So we have several hundreds of patients in post-CTVS constipation cases. We know that there are immediate post-CTVS is after major thoracic surgery where your sternum has been opened and the chest wall has been opened and it has been sewn back. The patients are in severe pain and they are on multiple drugs. Most of these, not most of these, 100% of these patients are on multiple drugs. We have given medicines to them and we have recorded their details. And we find that when we give these medicines, there are 3-4 drugs which we give, which are very commonly used traditional medicines for constipation. We know that it does not affect the efficacy of the allopathic drug. At least we know that. We have that registered data with us. We are good in stroke rehabilitation. So all stroke patients who come to Medanta in the hospital get Ayurvedic therapy. Mucositis in all patients who go for head and neck cancer radiation therapy get Ayurvedic therapy as an adjuvant, which is a part of it. All dengue patients who are admitted to the hospital with dengue fever, NS1 positive cases who are admitted in the hospital, whether they are in the ICU or in anywhere, get Ayurvedic medications simultaneously. Reversal of heart diseases, which is a program which we run, which is not exactly de-nourishous program. We have improved upon the program and we have added yoga, we have added dietary plans, and we have created a change in attitude, life attitude program also, which I will mention later, and insomnia. These are the areas which we are run as integrated programs. So this is the rest of them, and around 25 of them which I had just mentioned, which are the things which we do. starting from constipation, irritable bowel syndrome, swallowing difficulties, like post radiation therapy, people's muscle over the neck actually gets fibrous, so they cannot swallow. So we can easily manage that. Like many of the therapies which we add as add-on in allopathic medications are very, very simple, very easily trainable to the patient, and very cost effective. That means to manage the swallowing difficulty because of neck muscle fibrosis of a patient, we require one sitting, and maybe the cost of the medication should be for about 450 to 500 rupees, Indian rupees, and we give it to the patient and we teach the patient, we ask the patient to videograph what we are doing to them and ask them to take it home, and they do it for about 2 to 3 weeks and they come back, and the effectiveness is considerably very good. So what we do, we have, no, this is not something this is only picture, but please understand that this is what every Ayurvedic doctor do. I have just made it into a picture out of it, so don't think that this is something which I have invented, but only thing is that I have just tried to classify that and put it in simple format so that it is easier for us to, for other people to understand how we come to a conclusion on which kind of a disease or which kind of a treatment should be managed. So what we have done is, for example, in low back pain, we have somebody could have low back pain due to muscle pain, then they get a particular kind of a therapy. Somebody could have intervertebral disc prolapse or degeneration, then they have a different kind of a therapy. So that's what I was trying to explain in this. We have gone through severely debilitated patients with severe degenerative vertebral disc disorders who had been sent to us by the neurosurgeon who, because of some reason or other, the patient either does not having enough money or does not want to face the prospectus of a surgery, or having severe diabetes or cardiac problem or a kidney problem, could not go for surgery, had been sent to us for management with Ayurveda with the advice that I will meet you after 3 months. Let me tell you, none of the patient had to go back to the neurosurgeon saying that they wanted a surgery. They had all gone back to tell the neurosurgeon that we are okay. So that is it is excellent. This is simple Ayurvedic therapy which we include Panchakarma into it, and this is done by most of the Ayurvedic doctors. Only thing is that people do not know. The community does not know that the Ayurvedic doctors have this kind of a strong ammunition in their hand. I think that is the most important thing. That this ammunition, the idea that this kind of a strength is there in Ayurveda should be communicated to the community. We have osteoarthritis knee joint. Now we are planning for a nationwide program on Save Your Knee campaign. I don't know how many of our allopathic doctors are going to agree with that, because changing your knee is one of the most important thing that is a business pattern. You have a small knee joint pain, you go to orthopedician. I'm not saying all orthopedicians, but there are groups of orthopedicians who does that, who says that okay, now you are okay, you can walk around and you carry on with this for the next 4 or 5 years. Your knee will become so deteriorated that I can change your knee. So my question is, why do you want to change the knee? Why do you want to wait for the next 4 years so that your knee deteriorates and you have to change it? You can actually completely cure it, and Ayurveda has the answer for that. It is, everyone has two knees, fortunately or unfortunately. So every patient is 2 patients basically. It is like the dentist saying that every patient is 32 patients for me. Every single patient is 2 patients for us, and we can treat them completely, we can cure them completely if found in the right time. And we have excellent ways of treating them. We have a protocol which is managed. This is also home-based therapy. We teach them and treat them in 2 days to 3 days. We teach them exactly what is to be done. We give them the protocol, ask them to go home and come back for a review after 3 weeks or 4 weeks. That's what we do. So it's very, very cost effective. It is not that it is highly costly treatment, but the way in which what kind of a treatment is to be done and what medicine is to be given is to be decided by a doctor. For that, you need to go to a doctor. You cannot do that by yourself. It is not transferable over a piece of paper. It needs to be understood with the clinical understanding of the patient and the patient's need. Another one is chronic pelvic pain syndrome, where you have pain in the lower abdomen. Especially men have a big problem because many of them have prostatitis in a very young age, and then the prostatitis is the enlargement of the prostate gland, and it causes a very, very unfathomable kind of a pain in the lower abdomen, which I have patients who does not sit. Because the moment they sit, they have pain, a very severe kind of pain in the lower abdomen, and all these patients who come, because this is not a very common disease, but we are a specialty clinic, or we are a specialty hospital, so we get and a tertiary care hospital. So we get a lot of patients from this coming to the urology department. Every single patient who comes to the urology department with chronic pelvic pain syndrome are sent directly without even being consulted to Ayurvedic department for management. And not a single patient is retained by the allopathic department for management. We completely manage that. Our results are excellent in this. Incidentally, we know that we improve the uroflowmetry results also when we try to manage them. The urine flow also is improved when we try to manage chronic pelvic pain syndrome. Like, we manage a lot of cancer patients. Very few cancer patients come to us directly for full-fledged management of cancer. Very few. So I shouldn't say that I have been able to treat hundreds of cancer patients. I have not been. I have been able to support cancer patients very well. And this is a little bit old data. We have much better data right now. And we know that, now we have classified our treatments into something which are pro-treatment and pro-allopathic treatment and anti-allopathic treatment, or anti-allopathic treatment would be overcoming the side effects of allopathic treatment. But we have identified when to indulge in those such treatments. For example, I will tell you, chemotherapy or a radiotherapy is something which will, or let us say radiotherapy is something which will destroy or work in the DNA of your molecule. It tries to shatter the DNA, and that is how the cells die. Now, most of the Ayurvedic medicines, if you look at, for example, you look at Chyawanprash or Brahma Rasayanam has a cytoprotective effect. It helps in DNA augmentation, or repairing of the DNA. So you are, in one way, you are giving a radiation dose which will shatter the DNA, or kill the DNA, or remove the structure of the DNA. In another way, you are giving a medicine which will help the DNA to build up. So you are counteracting yourself, for a patient, as far as the patient is concerned. So you need to be careful when we add the Ayurvedic treatment and which kind of a therapy we add the Ayurvedic treatment. That's very important. And these are small learnings which we are having from the kind of exposure we are having. But it is because we are working closely with the allopathic doctor. They find that adding Ayurveda in the right time has a lot of difference and makes a lot of difference for the patient. Like, patients come to us due to different, they are worried mostly, when a cancer patient comes to us with reoccurrence issues, sleep, fatigability, pain, side effects, etc., etc. Like, there are hundreds of issues which a cancer patients fail, but most of them, which is signs and symptoms, we are able to manage with Ayurvedic therapies, medications, yoga, and counseling. Our kind of counseling is more holistic. We don't ask anybody to forget about something. We give them something else to think about. That's what we do. So that's like, it is a more holistic approach than kind of trying to create a mechanistic approach for everyone in a group. It is more individualistic and holistic. So they seem to accept it more. We work on mucositis of cancer, radiation therapy. This is when I told you about the fibrosis of the neck. There is a simple therapy which we do with an oil on the neck muscle, which can relax the neck muscle and improve the swallowing of the patient. These are quality of life changes in patients who had head and neck cancer and radiation therapy. What was the benefit? We had looked at few patients and tried to see what was the benefit we are actually bringing. There are hundreds and hundreds of papers published on breast cancer and related yoga. So I don't want to make any claim saying that yoga is good for breast cancer. Yoga is something, it is wrong if a doctor prevents a patient from doing yoga during a patient with breast cancer should be administered yoga. There is no doubt about it. That is the kind of evidence that we have as far as yoga and breast cancer management is concerned. Insomnia, insomnia is something which many cancer patients face. Probably it could be because of the disease itself, or because they are stressed, or medications. But to counter the effect, mostly sleep medicines are given, and patients do not want to go for more and more medications. So we, with simple therapies, including Shirodhara, it is not only Shirodhara, but including Shirodhara, have found that administration of such therapies can have a long-standing effect on the patient. So we have found that without sleep medications, the patients can benefit. Up to 75% of the patients can benefit with better sleep without sleep medications for up to 3 months. The effectiveness of the therapy varies off over a period of time, but it is a large number of days without any medication. So we will have to repeat the treatment for the patient, or otherwise we will have to give some kind of other medication to the patient. But most of them, half of them actually again come back with the complaint of insomnia after about 3 months. Post CABG constipation, I already told you this is a long before data. This is in September 2016, but we have much more patients now. We have divided them into 3 different groups. One, the most effective medicine, much more effective than all the allopathic medicines I have seen, is a medicine called Misraga Sneham. Nothing as good as that, like 2 grams of the medicine given to the patient with some warm water has more effectiveness than all the enemas and everything that is done. So, but you need to be careful because in the nurses who does not understand that might give instead of 2 ml, because usually Ayurvedic medicines are given in 2 tablespoons and 3 tablespoons. It has happened with us because the communication or the understanding of the nurses, they had given 2 teaspoons to the patient, and we had a big time sitting with the patient. We had to consider it like a snehapanam and ask them to take sound ka pani. They had to take with ginger water for a long period of time till the entire oil got digested in the body. But that is apart from the possibilities of mistakes done by clinical practitioners or caregivers, Misraga Sneham is an excellent drug. There is no doubt about it. Like there are 2-3 other drugs which you can also look at post MI. How much of an effect does Panchakarma has on the improvement of revascularization of a post-MI heart is something which we can actually see over here. It's a scintillogram, and the right one is a scintillogram on the after 3 years. It is the kind of Panchakarma which the simple Snehapanam and Virejana, nothing else, and supportive medications and diet and yoga given to the patient has a tremendous benefit on the effectiveness of heart revascularization. I think it is high time that we started looking into Ayurveda as one of the sources of or ways of revascularizing or rehabilitating cardiac patients. Like this is thoracic and minimally invasive thoracic surgery. This is another protocol which we have done. This is exactly what we do. A patient comes with many conditions into minimally invasive thoracic surgery. So pre-surgically we give them few yoga techniques. Immediately post-surgery, as soon as they wake up, like the moment they open their eyes, you have a yoga therapist sitting with them and asking them to breathe. Of course they will breathe, but we ask them to breathe the way in which we had taught them to breathe. So, and then it is very difficult for them to do it in the beginning, but we have found that it is extremely beneficial to the patient in getting out of the ICU first of all and getting out of the hospital much healthier. So that is one area which we have done a lot of studies on. We have done publications on this. This is also post-thoracotomy, pain management. This when you do robotic surgery, like the robotic arms go into between the ribs, and sometimes actually hurts the nerves which are going under the ribs. So what happens, and once the robotic arm is retrieved and then the healing process happens, for some people, for about 2 to 3% of the people, the nerves are actually caught between the scar tissue, and then the patient has severe pain. So there is no answer for this in allopathy, and we have excellent therapy for that in Ayurveda. It's external medication. There are 2-3 different kinds of medications which we use, but mostly we use the oil therapy. We make a well out of dough, and then we identify the area where we need to manage the pain, and then we do a tarpan over there, heat the oil and then apply it over there. It's an excellent treatment. We do it on a regular basis. We have done a publication on this. It is Journal of Thoracic Diseases, a very well-known thoracic surgical journal. Another one is stroke. Stroke, as I told you, like most of our stroke patients who get admitted into the hospital gets Ayurvedic therapy as an adjuvant, and the benefits are huge. If you look at it, the blue ones are those patients on standard of care, and the red ones on the left hand side, the bars says that the red ones are those under Ayurvedic care, Ayurveda add-on. You can definitely find that the RM score of the blue, the standard of care is much lesser than the RM score of the other one, the ranking score of the add-on Ayurveda. But at the end of the therapy, which is after 90 days, you can find that there is a definite benefit for the add-on Ayurvedic group. If you consider from the beginning till end, there is a considerably statistically significant difference between both the groups. And this we have presented in the World Stroke Conference, and we have got a lot of acclaim over there. And not because this is not the first time somebody is doing this. and many people have done this before us also, but we have started integrating that as a part of regular therapy in a modern medical hospital. So a stroke patient comes, we wait for about 3 to 4 days and we start our Ayurvedic therapy, and the day physiotherapy starts, Ayurvedic medication starts. So we are identifying few new ways of doing it, but that apart, it is pure Ayurveda that's being given to the patient. There is no new therapy, no new technique, but we are identifying the day in which we should intervene, the kind of interventions we can impart in the beginning, etc., etc. That's the only difference which we are making any. Like if you look at this, what we find is that on the left hand side you can find that these are the blue box shows you what is available to the patient if they take therapies from a physiotherapist, whereas the right side, what you get is the additional add-on benefits from Ayurveda. For example, in physiotherapy, it takes care of strength, balance, endurance, extremities become better, range of movements become better, mobility becomes better, your coordination is better, and activities of daily life is improved. Whereas, in Ayurveda, you find better muscle stiffness or reduced muscle stiffness, swallowing is improved, pain is improved, appetite is improved, pain is reduced, appetite is improved, sleep is improved, and generally the life part of life is brought back by Ayurveda, whereas the mechanistic part of life is brought in by physiotherapy. There's a big difference. If you know somebody who had this kind of a debilitating disease, you will know the difference between what is life and what is mechanical activity of daily life. So that is what Ayurveda brings in. If you ask me one disease which any patient should, without even thinking about anybody else, go for treatment in Ayurveda is migraine. You should forget about every other treatment methodology that is available across the globe. Go for Ayurvedic treatment for migraine. Like you will have excellent results. We have all these patients were sent to us from neurology department after several months of treatment, and we had been able to treat them excellently. It's very, very simple therapies which we do, which we mostly treat them with internal medications. Varanadik Geethakrishnan is the main treatment that medication that we give. We also manage their acidity and some gastrointestinal issues, which is according to the symptoms. It is treatable. It is so easily treatable that patients who have been suffering for 15, 20 years have been treated and cured in about, let us say 2 months, 2.5 months of treatment. And I think migraine is one very strong area of Ayurveda. We have been good in, we have been working with the modern medical department in dengue fever. We have worked with CCRA, Central Council for Research in Ayurveda and Siddha. They had given us a medicine which is Pitta Jwara Kashaya, and which contains about 4 ingredients, and we had given it to NS1 positive patients who were admitted in the hospital. We found that the quantum of side effects which usually is recorded for a dengue patient, especially the oozing out of the interstitial fluid into the interstitial space, and causing of lung accumulation of fluid in the lung and accumulation of fluid in the peritoneal cavity, all has reduced. Only one patient out of the 81 patients who were treated by us went into the ICU. Only one patient, and that patient also, I shouldn't say that, but that patient refused to take the Ayurvedic medicine, saying that it is too kadwa, means too bitter in taste, so they didn't take it. Anyway, it is an excellent medication, and we know that if the platelet count goes down, papaya leaf juice is the best therapy. There is no doubt about it. And I have got this information from a publication from Malaysia, the Malaysian publication had already done that about 3-4 years before, and it says very clearly how much quantity of medicine to be given, in what form it is to be given, etc. And we have given it exactly, and it works. Patients with low blood count, platelet count as low as 10,000, 12,000, etc., reaches back to 72,000 and 90,000, more than 1 lakh in about 48 hours. It is excellent. But one thing which we found is papaya leaf juice is not a preventive of dengue. Definitely not a preventive of dengue. And if you get used to papaya leaf juice, it doesn't work anymore. So one Godman in India, made a proclamation that if you have dengue, you start taking papaya leaf juice and giloy, which is Tinospora cordifolia, and people started taking papaya leaf juice and this particular plant on a regular basis, and then we started getting a group of patients who would not respond to papaya leaf juice. So it is some kind of a trigger that it acts, and it works probably for about 7 to 10 days, and thereafter it starts, the graph starts coming down. So papaya leaf juice is something which is very effective, but do not use it unnecessarily, and make sure that patients also do not use it unnecessarily. Melasma, and acne, scars, acne, we have excellent treatment for in Ayurveda for that. And if that is the simplest of things that we can start with in practice, this is what we should start with. There are hundreds of patients, thousands of patients who are ready to work with this. I could also make one claim, but with my face and my head, I cannot do that. Actually, we are very good in managing hair fall also. But the thing is, I came to know about it very late. But we can manage hair fall, we can stop hair fall. We have a lot of patients who are sent to us by dermatologists for management of hair fall, and we are able to do that. So hair fall is something which Ayurveda can manage. Similarly is acne, scars, and melasma. Melasma is something which is like the kind of people get discoloration on the cheeks and the hands and etc., which is very well managed by Ayurveda. We have also been working on wellness. I will take 2 more minutes. Is it okay? Yeah. So wellness programs in Ayurveda. So what we have done is we have thought that wellness is not the current wellness programs which run in most of the hospitals is that you go to a hospital, they take your blood, and then they say that you have cholesterol, you have diabetes, you have kidney problem. That's it. Or they say that you don't have cholesterol, you don't have kidney problem. Now you come back when you have a kidney problem. Or, this is what they say. But what we thought that is not wellness. And that is only laboratory work. So where do we go from to the next level? That is when we brought in Ayurveda into it. We started looking at people's prakriti. We do all these things, and we started predicting according to their their hormones and their laboratory investigations and their prakriti, the kind of diseases they can have and the kind of food habit they should have during a decade. So our diet plan is not for 1 year or 2 months or 3 months for reducing your weight for 10 kilograms or anything. That is given by a dietitian. We give a separate diet plan which is associated with the diet plan of the dietitian, saying that this is your 10-year diet plan, this is your 10-year lifestyle. And the most difficult thing that we find in people to understand and accept is to change their life attitude. Like somebody who doesn't go for a walk will never go for a walk. Somebody who had never been going for yoga will never go for yoga, probably go for 2-3 days. Like to make them go, what we did was we started putting coordinators. We had clinical coordinators now who calls up people and say that, sir, have you gone for your walk? Have you stopped smoking? Have you checked your blood sugar level, etc., etc. And you should imagine we have people who have shouted back at us saying that, why are you calling me every day? This is the way people don't want to change their attitude. So there in which we should bring in meditation, we should bring in the ideas of Ayurveda on the broader spectrum of life, how you should see life, how you should view life, what is your aim of life, etc. That's what we have recently started. Our experiments are not yet over, so we do not know exactly whether we are right or wrong, but probably next year or next to next year I should be able to give you some idea. These are the clinical trials which we are running right now. We are running one on obesity, we are running one diarrhea, quality of life in breast cancer, mucositis in head and neck cancer, Parkinson's management and thoracic surgery. These are our registered clinical trials. Then we have drug development programs in dengue, solid tumors, diarrhea and colon cancer. And index publications are in herbal drug development, integrative medicine protocol, herbal drug development again in and integrative medicine models. These are few things which we have published. We have collaborations, several of them, with CCRAS, with IIIM, with one German hospital which is working on Parkinson's, National Center for Natural Product Research, and SVIASA University, and one of the pharmacies from USA. So one of the things which one very beautiful book I had never found good enough to put down is Alice in Wonderland. I like that book quite a lot. It is one of the, it has a lot of things, once you read when you are a very young person or when you are a child, you find it very different from when you start reading it when you are a little bit old enough. So I think that there are 2 profound messages from Alice in Wonderland over here if you are trying to venture into integrative medicine. So when you start doing integrative medicine, you will always feel you don't know where to go. This is a big problem, like where to integrate, how to integrate, etc. So then Alice says that, would you tell me please which way I ought to go from here? Then the cat says, that depends on a good deal on where you want to go. or where you want to get to. And Alice says, I don't care much. Then it doesn't matter which way you go. If you don't care where you are going, then it doesn't matter, but you just have to go. And so long as it gets me somewhere, that's what Alice says. Okay, then the cat says that if you walk long enough, you will reach somewhere. But then you have to be ready to walk for a long distance, and you shouldn't think that it is in the next corner that things are. But then there is another question which comes, like another profound intelligence or information, wisdom comes from there, to be applied when you have a strange feeling that you are stationary despite the best of efforts. You might think that you are doing a lot of work, but you might, at the end of the day, if you reflect upon where you have reached, you might find that you have not reached anywhere. So then again Alice says, well, in our country, says Alice, still panting a little, you would generally get to somewhere else if you ran very fast for a long time, as we have been doing. Both of them were running somewhere, Then the queen says, a very slow sort of a country. Now here you see it takes all the running you can do to keep in the same place. And if you want to get somewhere else, you must run twice as fast as that. So you have to run fast. You cannot just imagine that you are going to do integrative medicine by just saying that I am doing everything what everyone else is doing. You have to do a little more than everyone else is doing. And the last one is, how long is forever? Do we have to run forever ever to find out integrative medicine? It's just 1 second also can be forever. It could be just behind the door. We might never know, but we have to read the door and look behind it to find out whether we have reached integrative medicine. So I think integrative medicine has great opportunity in this country, and I hope that my friends and my colleagues will take it up with different hospitals in this country and start making Ayurveda utilized properly for the Singaporean community. Thank you so much.